ages, deaths, and hospitalizations. Today, I'm announcing that we will further ease restrictions here in Baltimore and align with the state of Maryland's current executive order. The following changes will take effect Monday, May 17th at 6 a.m. Capacity restrictions for all establishments will be lifted, except, again, that's except in the following three categories, which are limited to 50%. Convention and banquet facilities, including convention, conference, banquet, catering facilities, community halls, and social clubs. Indoor venues, including any indoor venue where live performances occur, where motion pictures are shown, or where sporting events occur, and outdoor venues. Restrictions on gatherings will also be lifted with this order. Indoor dining still requires that patrons be seated indoors, while outdoor dining will now allow standing room for patrons. Now, while we are easing some restrictions, we must still remain vigilant and guided by the public health recommendations. Particularly with summer approaching, we must continue to take COVID-19 very seriously. I'm very proud that 40% of Baltimore has received at least one dose of vaccination, and at this point, 31% of our population has received both doses. But remember, that still means that out of every 3 people you encounter on the street, 2 are not yet fully vaccinated, meaning this is not over. And we also know that we have variants and strains of this virus that are still coming. We have a long way to go. It is not time to claim victory or celebrate just yet. Wear your mask when indoors, remain socially distanced, avoid gatherings, large gatherings, avoid contact with unvaccinated persons, and get the 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson whenever you can. There's plenty of vaccine available. We must all do all that we can continue to do to move forward and keep our loved ones and neighbors safe and healthy. I will now turn it over to Dr. Terraza to provide an update on where we are with our numbers and offer more details on recent data. Dr. Terraza?
Good afternoon, and thank you, Mayor Scott, for your steady leadership during the pandemic. To review our latest case data, we are seeing some marked improvement from our recent highs. Our daily new case count is approximately 129 new cases per day, a decrease of 45% from 4 weeks ago. To date, there have been a total of 51,995 confirmed cases. 959 Baltimore City residents have lost their lives to COVID, and we're now averaging close to 2 deaths per day. Our percent positivity is 2.8%, a 43% decrease from 4 weeks ago. Our intensive care unit and acute care unit capacity remain elevated at 88 and 87% respectively. However, we've seen an overall decline in the total number of COVID patients in both the ICU and acute care units. Given the improvement in overall COVID-19 metrics, Mayor Scott is updating our executive order to reflect an allowance for increased capacity in many venues effective Monday, May 17th. I believe the improvement we're seeing in new case rates is related to increased vaccination rates among city residents, and I want to personally thank every resident who has received a vaccine to date and encourage all eligible residents to get vaccinated. Vaccinations remain the key in returning to some sense of normalcy. Like other jurisdictions across the country, we are seeing waning interest in people who want to get vaccinated. But it's critical that we continue to strive for at least 80% of the population being fully vaccinated, especially if we want to try to avoid fall and winter COVID-19 disease surges. We are making progress as evidenced by the mayor's decision to loosen restrictions, but we are not in the clear yet. On May 10th, the FDA provided emergency use authorization for the Pfizer vaccine for children between the ages of 12 and 15. Today, the CDC's Advisory Committee on Immunization Practices will also be voting on its formal use in this age group, and we anticipate approval. We are excited to be moving forward with vaccinating the pediatric population, another critical step in our vaccination efforts here in the city. I'd like to share some of the data from the clinical trial that was done in this age group. The Pfizer vaccine was proven to provide 100% protection against COVID-19 disease for children between the ages of 12 and 15. To put this another way, of the adolescents in this clinical trial who received the vaccine, There were 0 cases of COVID-19. This is really incredible news. Similar to the side effects some adults may feel, common side effects for children included pain at the injection site, fever, fatigue, muscle and joint aches, usually lasting 48 hours after the vaccine. Just like in adult populations, the Pfizer vaccine for adolescents requires 2 doses that are given 21 days apart. Adolescents may experience side effects after both doses, with more side effects noted after the second dose. The Pfizer vaccine for adolescents has the same ingredients as the Pfizer vaccine for adults. We are excited about this approval and pending approvals for vaccine use in children because vaccination in younger populations will help to slow COVID-19 disease transmission among the greater population. I can't stress enough how important it is that our young people get vaccinated. We have seen that as vaccination rates increased among older adults, there was a dramatic decrease in hospitalizations for this age group. While healthy young people are less likely to be hospitalized or suffer severe disease from COVID-19, they are still at risk for hospitalizations, illness, and even death from COVID-19. Additionally, children with underlying medical conditions such as asthma, obesity, diabetes, sickle cell disease, genetic conditions, heart disease from birth, or suppressed immune systems may have increased risk of severe illness from COVID-19. As a pediatrician and a mother, the health and safety of Baltimore City's youth is my top priority. With summer on its way, now is the time for Baltimore City youth to get the COVID-19 vaccine. The vaccine will protect our young people from COVID-19 as they take summer trips, enjoy time with friends and family, go to summer camp, and work summer jobs. As with other vaccination efforts, we will be working with our partners to ensure equitable access to vaccines for our young people. For information on where adolescents can get vaccinated in Baltimore, please visit gettevaccinebaltimore.org. Again, that's gettevaccinebaltimore.org, one word, or call 410-706-3000. Again, 410-706-3000. Speaking of vaccination rates, as of this morning, as Mayor Scott noted, 40% of city residents have gotten at least their first or single dose of vaccine, while 31% of city residents are considered to be fully vaccinated, having received either 1 dose of Johnson & Johnson or 2 doses of Pfizer and Moderna. As a reminder, you are fully vaccinated 2 weeks after your second dose in a 2-dose vaccine series, or 2 weeks after your first dose in a single-dose vaccine series, such as Johnson & Johnson. We continue to provide vaccination to city residents through a lens of equity. Yesterday, the Baltimore City Health Department, in partnership with the Baltimore City Fire Department, started vaccinating homebound residents and their caregivers. This work is critical in reaching populations that are unable to leave their home for vaccination. The Health Department continues to work with our healthcare partners and community organizations to vaccinate homebound residents as quickly as possible. Eligible residents can sign up for the homebound vaccination program by visiting covax.baltimorecity.gov or calling our MAP hotline at 410-396-2273. Again, that's 410-396-2273. To increase transparency and provide more insight into our vaccination strategy, we have updated our vaccine dashboard at coronavirus.baltimorecity.gov and now show percentage of each zip code that has been fully vaccinated. This data will serve to guide the Health Department's vaccination outreach efforts over the summer as we look to create more opportunities for residents to receive vaccine in their neighborhood via pop-up vaccination clinics. We still encourage residents to register for a vaccine today, either by visiting covax.baltimorecity.gov or by calling 443-984-8650. This call center is available Monday through Friday from 8:30 a.m. to 6:30 p.m. and Saturdays from 9 a.m. to 1 p.m. And there are people available on the other end to help set up a vaccination appointment at the Baltimore City Health Department Vaccine Clinic. Even if you have been fully vaccinated, you should still be using proven harm reduction strategies to protect yourself and others from the majority of the population who still remains unvaccinated at this time. Please continue all of the same behaviors that have kept us safe to date. wearing a well-fitted mask over your nose and mouth when indoors and unable to socially distance, keeping your distance and avoiding large crowds and gatherings. Being fully vaccinated does provide certain benefits. You can safely gather with other fully vaccinated people in a private residence without wearing a mask, or with a single household of unvaccinated individuals in a private residence without wearing a mask, assuming no one in that household is at high risk. Before I close, I'd like to also acknowledge that today is the last day of National Nurses Week, a holiday that has become more important than ever over the last year of this global pandemic. Words cannot express how significant a role our nurses play every single day to keep our city and country healthy, a role that historically has not been acknowledged enough. It should not take a pandemic for us to realize that our nurses deserve our respect every single day for their tireless work in keeping us safe. And it's my sincere hope that one day soon our nurses and other healthcare professionals will be able to take a break they so richly deserve. In closing, again, I would like to encourage all residents over the age of 12 to get vaccinated as quickly as possible. Vaccines are available, and they're the key to helping us return to some sense of normalcy and avoid fall and winter COVID resurgences. Please get vaccinated and encourage your friends and family to get vaccinated too. Thank you.
Thank you, Dr. Zaraza, and all that you and the health department has done in your life-saving work over this past year. And also, just heartfelt thanks to all the nurses and all the work that they do each and every day. As Dr. Zaraza said, they haven't had to get a break. When everyone else has been able to just decompress, they have to be on the front lines, and we have to thank them. They have put themselves at risk of contracting this virus more than basically anybody, and we have to be very thankful for them today and every day. I want to slightly switch gears and discuss an exciting announcement that we typically do around this time of year from the Department of Recreation and Parks, and I am thrilled to announce that these newly loosened restrictions with these cities' pools will open for the 2021 swim season. From May 29th through September the 6th, 14 city pools will open. This includes 4 park pools, 7 community pools, and 3 indoor pools and aquatic center. To kick off this announcement, we will be hosting the annual Big Splash, which will take place on May 29th at Roosevelt Park Pool at 11 a.m. I can't wait to be out there to jump in the pool myself. Residents can visit bcrp.baltimorecity.gov/aquatics for more registration and additional pool information. In addition to pools, Rec and Parks has opened 10 additional recreation centers for community use. All activities, including rec center and pool access, require pre-registration via the BCRP website. Again, that's bcrp.baltimorecity.gov, and walk-up registration is permitted, but subject to availability. For a reminder, Drew Park Pool and Cherry Hill Splash Park remain under construction and closed for the season, but we are very excited that next season they both will be reopening and be fully renovated and expanded, and we're looking forward to that for the Big Splash in 2022. So we just have to hold on for one more summer and be able to partake in those new facilities. Roosevelt Park Pool and Middle Branch Aquatic Center will operate in their place this season. The start of our summer season also ramps up our agency hiring efforts. Anyone interested in a full or part-time summer job should visit bcrp.baltimorecity.gov. As a former employee of Recreation and Parks, it is one of the most rewarding agencies to work with. You get to work directly with our young people and our families, and you learn a lot about the city of Baltimore. And we look forward to Director Moore investing more in our recreation and pools facilities for the benefit of all Baltimore residents, especially our young people and their families over my tenure as mayor. And I will now turn it over to Director Moore for more details. Mr. Director?
Thank you, Mr. Mayor. As the mayor stated, we're so excited to be here today to highlight the opening of our pools for the summer. Just a couple things I want to highlight. Our pool operations on Monday through Fridays will be from 1 to 6:30. Saturdays and Sundays, they'll be open from 11 a.m. to 6:30. To keep everyone safe and healthy during our pool seasons, just like we did last year, our pools will be broken into a 90-minute session. So swimmers will be able to swim for 90 minutes, and then the pools will shut down so that we can clean for 30 minutes and then we'll reopen for the next group. We have to continue to stress that we want people to register online, but we will be welcoming walk-ups as availability is there. And the last thing I want to highlight is the mayor stated we are in the process of hiring, so if there's young people that's interested in working in our pools or working in our rec centers for our summer camp, please visit us at bcrp.baltimorecity.gov for more information. Thank you.
Thank you, Mr. Director. And before we turn to questions, I want to take a moment to address public safety in the city. We know that yesterday we had several incidents of violence in the city, and to date we've had 113 homicides and 233 non-fatal shootings. I want to first start off by thanking the women and men of the Baltimore Police Department for their work throughout the year, including just yesterday closing one of those shootings, a quadruple shooting on West Lexington Street. Really thank the folks from the Western District and their district detective unit, but also to note that including open warrants, we currently have a homicide rate of 47%, and we also have recently opened 15 warrants for people who chose violence and chose to shoot another person and another human being. Rest assured that this is my top priority, and that the hard-working women and men of the Baltimore Police Department, in particular those in the Warrant Apprehension Task Force, are working hard to track these individuals down, these shooters down. And I want to be clear again, this is our top priority. We will not rest until we bring these people in. We're going to continue to push to make sure that they know if they choose to harm another person over some little silly conflict, if they choose to just shoot someone randomly, we will look for them relentlessly. And I am your mayor, but I want everyone to know also that I am also a Baltimorean. This is something that does not impact me. It's something that impacts us all. We all know. Anyone who has lived in Baltimore for a period of time knows how this impacts us all, and we have to treat this like an issue that impacts everybody in the city. Thank you, and we take any questions. Alexa?
I'll start with crime since you just touched on it. Regarding the council that you want to restart, you just sent out that letter. How do you plan to convince the governor on this, since in the past he said this is ineffective?
Well, Alexa, you know I'm meeting with the governor, and I will tell you how I talk to the governor about this after I meet with the governor, because we said we would not be discussing what we're going to talk about in our meeting in the press.
Regarding the COVID restrictions, the fact that you're now easing restrictions, why cancel events such as the 4th of July, Artscape, those money makers, when they're held outdoors?
Well, what I'll say is that, again, when we're thinking about, this is not over. COVID is not over, Alexa, and we all want to make sure that we get back to a point of where we're having these big festivals and events, but that would be, right now, would not be in the best interest of public health, which has to come before money. We will get back to having Artscape. We will get back to having AFRAM, which is my favorite festival, and we're looking forward to having AFRAM and Artscape be bigger and better than ever next year. But in order to get to that point, we need people to get vaccinated so we can put this thing behind us.
With going to the CDC's,
we're going to the next question, Alexa.
I just piggybacking
next
off of
question,
that,
please.
the
You've
piggybacking
asked
off
two.
of
You
that,
have
the
your
CDC,
colleagues here
is there a
waiting.
two-limit?
We can come back around. Go ahead.
Just going with that, there have been reports that the CDC's outdoor transmission, that is grossly exaggerated. Your thoughts on that, or maybe the health commissioner?
So what I would say is that we hear these reports from these folks who simply don't believe, same folks didn't believe that COVID is real. And when you think about these kind of events, when you're having hundreds of thousands of people in close contact, and we know that we only have 40% of our population vaccinated, that allowing people to put themselves at that kind of risk level is irresponsible.
Thank you.
So there's a possibility that the emergency use authorization for 12 to 15-year-olds will be allowed today, guidelines from the CDC. What plans does the city have to ensure that 12 to 15-year-olds will be able to get vaccinated ASAP?
Yeah, so I mentioned the website that parents can go to now, getthevaccinebaltimore.org, and that is, again, sponsored by our partners who provide Pfizer vaccine. What I will say is the health department has traditionally had either Moderna or Johnson & Johnson, so the health department clinics currently don't have the Pfizer vaccine for children. However, our partners do. Like with all of our other vaccination efforts, we will work closely with our healthcare partners, community-based organization, and city schools as we think about and plan for vaccination. So that includes provider outreach. We know that vaccines will likely go to pediatric providers who are very well-versed in providing children with vaccines. Additionally, it'll go to our hospital partners and our mass vaccination sites. So a lot of our role will be helping to coordinate and ensure that children can get to those sites and are aware of what sites are available. In addition, working closely with city schools to consider possibly some school-based clinics and pop-ups. But again, getthevaccinebaltimore.org is available now for parents to go to and begin to sign up.
Is there any idea of when things may be flowing more quickly for the kids? For example, Howard County just put out something that said they could show up at the mall if it happens today or tomorrow and get this. Is there anything more direct here in Baltimore City where people could just go when they...
Yeah, I think, again, our partners will, and I don't want to fully speak for our partners, but I think they will likely be prepared this week. Again, knowing that it's Pfizer, I think one of the challenges is that it's just one of the 3 vaccines that are on the market right now. As all of the vaccines are approved for this age group, if we see that day, then there will be a lot more flexibility. But right now, with it just being the Pfizer vaccine, it really is limited to those sites that already had Pfizer in their stock.
I also want to ask you about you guys going door to door to help the people who are homebound. Talk about the importance of that and actually finding those people.
So again, I will say the number, if you are a homebound resident or you're a caregiver for one, is 410-396-2273 or covax.baltimorecity.gov, and it will prompt you to understand if you're homebound. But the importance cannot be overstated, right? We know that a lot of our homebound residents perhaps have underlying comorbidities or things that limit their mobility and would make it a lot harder for them to get to any vaccination site, whether it's at a pharmacy or a local clinic. So this effort with the fire department is extremely important to reach those individuals and to reach their caregivers who may be traveling and have possible exposure risks, even if that homebound resident doesn't have those same risks.
One more question on that. You know, with the Department of Aging, they put out their dashboard last week about how many of the employees, the staff members, are now fully vaccinated. Baltimore City is actually identically on par with the state at 63% of all folks are vaccinated. What efforts are there to get 100% of these staff members vaccinated?
And you're saying staff members for the state's Department of Aging?
For any of the nursing homes across the state, nursing homes, assisted living facilities, whatever their guidelines are on that department's website, I think they do a holistic view of it.
Yeah, so again, we started our mobile vaccination efforts in senior housing sites. So we started those launched on January 29th, and proud to say that in the past week, we've been able to complete all of the senior housing sites. There were 117 here in Baltimore City. Either us or a partner was able to go to all of those sites and provide vaccination for our older residents in those sites. To your point, we know that we're going to have to continue to shift our vaccination approach as availability increases and as interest in people signing up decreases. And that really means going out into the community and being present in vaccination efforts via pop-up clinics to ensure that all of our residents are vaccinated. I'll also mention our map. So our map now shows the percentage in each zip code that's been vaccinated, and that is the data that we're looking at as we plan out where do we go next with pop-up efforts? What areas in the city have the lowest vaccination coverage rates, and where are we potentially seeing higher new case rates?
Okay, thank you.
Pete?
Hello, Mr. Mayor.
Hey, sir.
My question is totally 180 degrees out of phase here. Gas prices are going up. The pipeline is an issue. Have you thought of or worked with any of your staff about the contingency if this runs past Friday into next week or a month, or especially since we got hit with a big cyber issue a year or so ago?
Right. As of now, sir, we are not anticipating a major impact. We have around 14 days worth of fuel for the city. We're going to continue to work with the Department of General Service and others to monitor the situation and make adjustments as necessary.
Now I know you're meeting with the governor. I'm not asking a question about the other side. Would this be a subject like, say, if, because, you know, this thing could go longer, what would you do past that, or with your staff for cybersecurity? Have you worked on any of those thoughts to kind of prepare? You know what I'm saying? It could easily go past the 14 days if there's
Yep.
stockpile or.
So what I would say to that is very simple, that we have an emergency management office and we work through that. We will not share those kind of details in a public forum like this in order to protect the city and the residents of Baltimore.
But you want the residents to say, hey,
We're-
you on top of it?
We are on top of it. We don't take these things lightly, especially since we've been through one of these ourselves, so we know how it works.
Thank you, sir.
Thank you. Emily?
One quick question. You had talked about the different venues that were going to remain at 50%. Has there been any discussion with Camden Yards? I know they're voluntarily at 25% right now. Do you know if that will be expanding?
Well, as of right now, no. And in my conversations with them and Dr. Girazza's conversation with them, they have an approach that they're going to take, and they're going to follow that approach. And we're going to talk with them and meet with them. They're great partners. They always come. The Orioles always come to us as partners, as a part of this community. An organization that has been here for so long, always looking to do not just what's in the best interest of them on the bottom dollar, but in the best interest of our community. Thank you. Thank you, everybody.